The bonding project that we're working on right now is, I believe the number is about 17 million. And we're going to be doing OR remodel is kind of the primary bulk of that. About $6 million of that is going to be for an OR remodel. And then we're also refinancing some of our bonds that we had that were on a variable rate, and with the interest rates being very favorable, we decided to bulk that in since we were going to do some financing anyway. But the OR project is we're adding 2 more ORs and some additional outpatient space to that area. We've grown as an organization about 75% in the last 3 years, and we've outgrown that space. We added the building we're sitting in right now, or the addition we're sitting in right now, we added 3 years ago. And at that time, we opened up some space on the peripherals of the OR, knowing that eventually we were going to be expanding our operating rooms, and we're now to that time period to do that project.
So what is? Can you kind of explain or describe a little bit of the need for an additional 2 OR?
Well, it just comes from that, the need of needing more OR time with the growth that we've had, and right now we basically have to schedule out or schedule around physician schedules to try to get them ample block time in the OR, and this will allow us to give them more time to be able to do more surgery in the organization.
And so by growth, are you referring to increase of patient load? Or?
Yes, exactly. Yeah. So we have 2 additional operating rooms. We're basically doubling our capacity of what we were able to do before in the operating room. So we'll be able to take care of basically twice as much as we were before.
And I guess what's the timeline for?
We're starting a timeline where we've been designing now for the last 3-4 months, and we're going to finalize that design over the next couple of months, and then we'll start. It'll go out to bid, I'm guessing in March, April, and then we'll start construction at that time. And the goal is to be done late 17, early 18 with that particular project.
And so how will this? What will patients see? How will this affect patients?
Really, from the patient standpoint, they're not going to actually. Most of the time in the OR, you're sleeping, so they're not going to actually physically see. What they're going to be able to do is be able to get in and get scheduled and get their cases done operatively on a quicker basis than they would have been before, because we just didn't have the volume to be able to handle that. And additional services and expanded services and more hours available and those types of things will definitely be a patient satisfier as well.
Great.